Are we on air? I think we're on air. So, hi, good evening, and welcome to the IBD Ostomy Support Show. I'm Louise, aka Crohn's Fighting. Apologies if we are 2 minutes late, but we're just sorting out a couple of final things before we came on. So tonight we are discussing whether or not you may have received lack of care whilst you was in hospital. I think would be a good way to be diplomatic with regards to that. How to make a complaint and how to use.
I would say lack of person-centered care. As a healthcare professional, I would label it as not person-centered care.
Person-centered care. Lack of care, just not receiving any care. So, and we'll be talking about the PALS department that they have in well, they should have them in all hospitals in all fairness. So, that's what we'll be discussing tonight. Unfortunately, Rachel and Natalie aren't joining us this evening, but they will be back next week. So we miss you guys. We love you, but please rest up. So what have I been up to? Well, apart from having a unfortunate run-in with my stoma nurse last week, had a pretty... What did I do at the weekend? Oh, yeah, I took the girls to go and see Father Christmas and got lost driving back up the M26. I come off of the M26, ended back up on the M26 because I took the wrong turn off because I'm not good with the sat-nav. And it wasn't until I got a further 14 miles down the road that I actually knew where I was. And took the magical mystery tour to get my niece back home. So, yeah, I took my daughter and my niece to go and see Father Christmas over in Tenterden. What did I do Sunday? I can't even remember what I did Sunday, honest to God. My brain can't tell you. I know I had pasta in the evening, but that's about it. Been watching Gold Rush. I'm so sad that I have no more episodes of the Alaskan Bush People to watch. That program is absolutely epic. Been watching Christmas films. I've got a date with Mamma Mia at some point.
It's not December yet.
Oh, I'll watch it. So a quick hi to Ostomy Online, Chris Levitt, Paulette and Derek, as they're all on the live chat. So we say hi. So for any of you that have seen some posts on my wall with regards to needing 11 people, I've got all 11 people. I would like to say thank you ever so much for messaging me and agreeing on my rather madcap idea. And a big thanks to Graham, who was a huge source of entertainment via my email today, sending me the video clips for what I need. So I would like to say an absolute massive thank you for that one. There's only 4 attempts, wasn't it, love? What else? Oh yeah, I've had a blog post go up with Pelican Healthcare this evening. I have shared it amongst the groups. It is on my Crohn's Fighting page about ERNs. So that is an enhanced recovery program that should be run by the majority of the NHS trusts. It's a great program. It gets you fitter, healthier, and it's meant to reduce the readmissions after being discharged from having surgery done. So I can't rate the program enough. They've helped me. Something chronic, and my ERN is still giving me weekly phone calls at the moment to make sure that I'm behaving. Was you under any ERN care whilst you was in hospital, Steve?
Yeah, I was. You know what? They had me up the very next day. I was on my Zimmer frame, whizzing around the ward with all my tins hanging behind me, like just married. It was, yeah. You know what? At the time I was thinking, what the hell are they doing? But no, it is really clever. It didn't happen last time I was in. But you know, the quicker you're out, the sooner you're up and about, and you're out of there. Yeah.
I think they're great. I have to admit, I think the first 2 days, especially within the recommended time frame of 12 to 24 hours after surgery, they want you up and out of bed, at least sitting in a chair. Doesn't matter for how long for, but they just want you up and out of bed. It feels like it's sadistic. You don't want to do it, but I think you're that high on pain meds at the time you don't really care. You just do as you're told.
Getting up out of the bed and stuff is to help relieve any fluid on the lungs, which every operation I've had fluid on my lungs.
You know what, Steffi? You mentioned that. I think that's one of the hardest things you have to do. Them very first coughs that you try to do.
Yeah.
You know, because it's so painful, isn't it? They say roll up the pillow, but you're huffing. Yeah.
on my very first blog post that I'm pretty sure I wrote whilst I was in hospital after my surgery. So the very first one after my surgery, I think it's Hello Ostomy or something. I'm pretty sure there's a picture in there of my dad and Stephen rubbing my shoulders because the pain was unbelievable.
Wow.
Because it sits here and like on your back, and I really struggle after generals with fluid on my lungs from anaesthetic.
It's horrible though because you can feel it, but you haven't got the strength to. It's painful. Every little huff. It's so painful.
Yeah, because the main problem that you've got with fluid on the lungs as well is if you're laying there for long enough, that leads to pneumonia, especially in older patients. And I've had pneumonia twice.
God, it's made me want to cough now. That has.
Yeah, don't. Do you know what? Coughing still hurts. Every time I cough, I think I'm going to pop something. I think I'm going to split my bum back open every time I cough off, and it's not a pleasant experience.
But it's still early days, really, when you think.
Yeah, it's true.
Someone
We've been done with this in the past.
Someone on my Twitter account actually said, no, it was either Twitter or one of my emails that said that they were told it could take up to 2 years to be fully recovered. And I'm like, oh, I've just hit that mark, but I'm pretty sure but I was pretty screwed though, wasn't I? Because I fell pregnant pretty much straight away.
I think my surgeon said 6 months before I start feeling relatively human. Okay, I'll give him that. I'm still not feeling human, but hey.
I think it was 4 months for me when I had mine done.
I think it's the fatigue stick. I say fatigue stick. I say it's the fatigue bleeding tree that crashes into you at least twice a day.
Part.
It is.
That is really.
I went back to work after 3 months.
Too early.
I had no choice.
Right, shall we continue with our introductions, Steffi?
Yes, we'll do Steffi.
Hi, I'm Steffi from IBD Ostomy. Currently dealing with a cold that my lovely children have given me. Normal person sick is the worst kind of sick you can be when you're chronically sick and live with pain and everything every day. I was in hospital last week. My actual in-ward care was pretty good, minor some few little hiccups that were pretty minor in reality, but my A&E wait time was pretty horrific, which I wrote a very long post on talking about it, which fits in quite nicely with today's topic. What the hell have I tomorrow's my first shift back. I've been off. I missed 1, 2, 3, 4 shifts. I went and had my isotope bone scan on Monday. I've got to go start my physio in a couple of weeks. Lyra Beth just found out she's going to be the Star of Bethlehem in her nativity, and she has like a little entourage of other stars, which there's four other stars, I think, and all of them are like some of her best friends, so that worked out quite nice. One of the little kids was like, I really wanted to be Mary, and her mum turned around and said, oh, you'd probably have a lot of speaking parts. All right, no, I'm happy being a cloud. I'm happy. I'm good. Not that I'd ever known about clouds being in nativities, but anyway.
It's a changing world.
You've watched Love Actually, haven't you? Where they have the lobsters.
No, I've never seen Love Actually. My best friend goes mental at me because it's his favourite film, and I'm like, I don't want to watch it at all. But I'm looking forward to Saturday because it's December the 1st, which means it's a wonderful life day. Like October the 1st is Hocus Pocus Day, and that like December the 1st is when I can start watching Christmas films and start doing the annoying elf on the shelf crap.
If you need any ideas, a carrot and a cheese grater.
I've got a board dedicated to it on my Pinterest. The Beauty of Secret boards on Pinterest. I don't really think I've got anything else. Oh, I had 9 children running around my back garden today, playing with stuff that was supposed to make snowballs that didn't make snowballs, but they still enjoyed throwing it all over my garden. But it disappears with water, so as long as it rains tonight or in the next couple of days, it's good. It was all right, and then I had to text all the mums afterwards saying I'm really sorry I kicked you all out. I started to feel really poorly, like really faint. Because I've had all my loading B12 injections, but you've got to have iron with it, and I've had the rheumatology ring me up, and well, I rang them up last week, and I was like, I'm supposed to be having an iron like supplement with this. I was like, I can't. Tablets are a no-go because I don't have that part of my anatomy that absorbs it. I was like, I just can't tolerate the liquid. It makes me sick. Like, so I'm gonna have to not have an iron infusion. I was like, I'm currently in hospital, so it might be easier while I still got a cannula in to come do it. And my consultant on Monday was like, no, we're not. No, you have to be out of hospital. I'm like, well, I am now. And he's like, right. His nurse was like, right, okay. Have you actually had an iron infusion before? I was like, yes, many times. Have you had one since having your stoma? I'm like, yes, I have. And they were like, all right, okay, we'll get back to you. And I've already, and the tachycardia started again, and the pre-fainting started again. It's like, God, just leave me alone, let me be.
The thing is though, is you Steffi, full well, I know full well, that to get to you have to fight for the iron infusions. It's just.
I've never had to fight for them ever. The one time that they were going to just give me an injection was after Jacob was born. I was like, I think you're not going to do that. But it's all at this hospital that I have issues with, to be honest. It's just a shame I can't have all of my teams at the one hospital. But there's more clinics at this other hospital because it's bigger.
Well, I make you laugh. Don't drink berry Fanta. It turned my output green, and I nearly had a oh Jesus Christ moment when I emptied my bag in the bathroom just before I come on. Don't drink it. It makes your output go green. Anyway, I'll pass you over to.
I was going to say I'll pass you on to Steve now because I think I'm done.
Okay. Hi, I'm Steve, aka hashtag the bag daddy, the daddy of the bag. I was going to go into a song then, but I'm not going to. My week has been a mixed bag. Just after surgery, I was asked, I had a bit of an opportunity. I was asked by Coloplast if I fancied going to California to do a talk to about 150 healthcare professionals and people from Coloplast. Unfortunately, my doctors wouldn't. I got a letter off my surgeon and a letter off my doctor, but they weren't saying yes I could go. They were saying, yeah, we feel he's okay to go, but because it was 4 weeks after surgery, he needs to be 6 weeks in order to get that go ahead. So I couldn't get insurance, so it didn't happen. Otherwise today I would be missing today because I'd be in California, but so that never happened, which was a bit of a letdown because it's kind of like, how often do you get a chance to do that?
Okay.
But who knows what's around the corner. I've been this week. I've been cooking. I cooked a big stew last night. My house smells of beef.
I bet that's making you happy.
It's really nice. I had a wonderful present off Chris, my good friend Chris. She had me in bits. He sent me like
my Irish firefighter.
Yeah, no, not Chris. Not that Chris. Chris Livitt. Hi, Chris. It's a wooden car. Basically, you build it all. You build the pistons and everything works on it. So I've been burying my head in that because I've been struggling a bit this last week. Physically, I'm doing well. My bottom wound is fantastic. It's been good as gold. My tummy wound has been a few issues. There's been, it opened up at the top. It's still sort of leaking a little bit. Not a great deal. So, but mentally, I've been having a few issues. A few sort of upset moments and stuff. Can't really sort of put my finger on it. But we get there in the end. It's more than just a physical illness, isn't it? What we go through, and
Definitely.
And hospital admissions, they kind of hit you differently.
They take a toll on you,
They really do. I mean,
and you think you're prepared, and you're not always, because something might
yeah.
happen.
I've been to the doctors today, and I've organised some medication in order to give me a helping hand. And that's kind of me, really. I haven't really done a great deal more this week. It's been kind of like my issue is at the moment is before I was working, I was coming home. There wasn't enough hours in the day, and now I'm not working. There's all the hours in the world. I'm waking up in the middle of the night, and I'm just thinking and overthinking and analysing. My brain's can't switch off. It's kind of like it's difficult, but you know, recognizing it first, recognizing that you're having issues is the first thing, and then obviously trying to sort it out is the next best thing.
Mm-hmm.
Steve, I know what you mean.
It's the hardest part, admitting it.
But you know, I've got a good bunch of friends out there that are really supportive, and I know that there's always somewhere I can turn to, you know, to get a bit of support. I've done loads of support myself over the last few years, and so I know that it's readily available for me. And I'm talking about friends now. I'm not talking about, you know, doctors, nurses, and consultants.
Are you just finding yourself overly emotional, so you're just literally crying at a drop of a hat?
Yeah. It's ridiculous. I went to the doctors today, and they luckily it was a nurse, you know, and she said the first thing she said was, "What seems to be the problem, Mr. Cartmile?" And I just about managed to get out, "I'm struggling." And then I was in bits doing that thing that women do, you know, and you go, madness still.
I bawled my eyes out watching the end of the Beauty and the Beast last night, like the Emma Watson version. I don't know why I just started crying. I can't control it at the moment. I've managed to keep a lid on it most of the time, but I think it's frustration. I think it's loneliness, and I think it's because, you know, your body's been through a lot. It's a combination of things,
and it's this time of year as well. It's, you know, it's a combination of being stuck in with my own thoughts, whereas normally I'd be at work with banter from lads. Not being able to go to the gym, that's massive. That is for me, absolutely massive. The gym has always been my therapy. I like, you know, I like to train. I feel good when I come out of there. It releases endorphins. I haven't got that at the minute. You know, my surgeon said gym will be good for your you know, rehabilitation. But I can't really go to the gym, not by my work anyway, because people from work will see me there and they'll just see, well, if you're well enough to be in the gym, you know, you're well enough to be at work, which is tough. But it's one of them, isn't it?
Stupid, really, because it's essentially like a physio, and it would help your recovery, which would get you back to work. Not necessarily quicker.
I'm probably going to visit a different one, to be honest, unless you're listening from work, and then I don't know what you're going on about.
But at the end of the day, if your body's not strong enough, when you do go back to work, it's going to hit you like a ton of bricks.
It is, yeah. I mean, I've been doing plenty of walking. I'm just lucky that
my job wasn't. Because I work in care, and I did nights when I went back. I was sat on my ass all night, every hour getting up to go check on the guy. That was all I did, really. Whereas your job is even more like hands-on than mine was. You know?
I think it's just being in that environment, isn't it? You know, with other people. Mm-hmm. Your thoughts can be your worst own enemy most of the time. You know, you question yourself, you think about stuff, and you overthink. You know, I've been looking at like mindful apps on my phone and that help you. You know, not so much. Well, just deal with it. Just let things wander in and wander out of your mind without actually, you know, without actually focusing on them. Anyway, that's me. That's my kind of week. I'll put you over to Graham now.
Hiya. Thanks. I'm Graham, G-Man, back for life. My week, or few weeks, I had surgery 6 weeks ago for me Botox into the bladder. And it's been a longer recovery than usual. I had a few problems in hospital, which I think we're going to cover later on in the show. But this week, on Saturday, I started to get really bad chest pains. And it was quite frightening because my chest became really tight and I started to panic. and my parents were worried as well. So I suffer from what's called Barrett's esophagus. I don't know whether any of you have heard of that. It's where the esophagus becomes really inflamed, and the lining of the esophagus can become very similar to the lining of the intestine, and it burns, and the pain is just horrendous. Luckily, I had some medicine that my GP gave us in the summer when I had a mild episode of it. So I took some of that, and that eased everything after about half an hour. But I've still been getting these pains, or I've had these pains in the chest. Can you still see us?
Yeah.
Oh, right, it went blank there. But I've been having pains in the chest for about 4 weeks now. So I've been told I've got to have a heart monitor put on for 24 hours to see what's going on, because I'm getting these palpitations, and it's just coming and going 5 or 6
I had one of them when I was about 14, 15. That was fun, because you got to write down what you're doing so that they know. Yeah, so that if you're doing, say, like you've gone up the stairs and you're a bit knocked going up the stairs, they can go, right, okay, you walked up the stairs.
Right.
And then rather than, so if you're sat down and your heart goes, they'll be like, right, okay, that's something abnormal. So if you're doing anything that gets you out of breath normally, I said walking up the stairs makes me out of breath. So
it does with me now.
But if you make a note of like, it doesn't need to be the exact time, but in like as close to, so that they know.
Yeah.
Like, and that way it'll actually be more beneficial for you.
Right. Because I have noticed I'm getting out of breath an awful lot now, especially when I'm walking outside. So we'll see what this shows up. And I had physio yesterday for me pain in my spine, lower back, and my foot, which I broke a few years ago. And we've decided to give acupuncture a try. So we're going to try that next week. I don't know whether anyone else has had it.
My sister-in-law's an acupuncturist, so I've had it a few times.
Did it work?
I'm
going in it open-minded.
Well, no, the first time she did it, I just got back in from a really shitty day at work. And she put some needles in my hands, and I have panic attacks when I have needles in my hands from loads of blood tests and whatever when I was a kid. So that one didn't help. But she did my lower back just before I was due to go into hospital. And other than the fact that my back still felt like it was on fire for a couple of days, it wasn't like painful on fire. It just felt very hot. And she was like, oh yeah, that's normal, don't worry about that. But like, it doesn't ease things straight off the bat. You've got to keep going. Whereas otherwise, so if I'd gone and had a few more, because she used to come around and do Stephen's back, and he had a few sessions that I needed to, it relieved it a little bit. So. But his job, it was never going to go with. So, but it's worth a try. It's worth a try.
Yeah,
you know?
That's what my GP said today. But this physio, he can only give us 5 sessions. And he says if it works, I'll probably have to go back to the pain clinic and get them to give us more sessions. So we'll see what happens, see how it goes. But that's been my week, really.
Cool. So, should we talk about PALS first before we just jump in with what we've had that's gone wrong and how we've dealt with it? Should we start with something that should be positive when it comes to mismanagement or lack of person-centered care?
I've used PALS twice, and on both occasions they did solve the problem. The first one was about 7 years ago. I was in a renal ward where I should have been on a urology ward, but urology was saying I should have been on a renal ward, and the arguments started at my bedside with doctors saying you should be looking after him for this. It was when I had to start to self-catheterise, and the argument was just getting out of hand, and at the end of the day I didn't know which team was supposed to be looking after us. And they walked away and they said, oh, this team's going to start you on the self-catheterization. And I was on the renal ward at the time. 3 days went by and I saw nobody.
Great. I'm sure Rachel's had that happen.
And they said, oh, it should have been someone from urology coming across to train you. And so that's when I got in touch with PALS, and those had a big meeting and they got reprimanded. And I got a full formal apology from both teams.
It's hard when you know it's a miscommunication thing where one person, like I get it from my stoma nurses. The other one thinks they've emailed me back, and it's never anything important. Like, because if it's important, I'll ring them rather than email. But like I've gone through PALS when the hospital wasn't catering to my dietary needs. They would literally have like, when I was pregnant, I really couldn't eat meat. I was really struggling with meat when I was pregnant. Like I can't eat meat. I'm not, my vegetarianism isn't ethical. I just don't get as much pain if I don't eat meat. So that's it. Like I will eat meat, but it's not my first choice. And I went through PALS, and they were like, "Oh well, it's actually nothing to do with us. It's Carillion, which is like the outsourced hospitality," which confused me. I was like, "Why have an outside hospitality services when the Friary, the sister hospital, has its all, like everything, like the patient, the kitchens, the domestics, the house, ward housekeepers, the security, the switchboard, all of it's in-house
on-site
hospitality." But Carillion didn't ever get back in touch with me. They went bust the month after. So, but they're still the new ones, the We Care or whatever it is. They still can't meet your dietary needs half the time. There's barely any like low residue and stuff. So like when my stomach was playing up, they were just like, "Well, we've only got this sandwich in brown bread." So I'm like, great, just what I want. But like PALS themselves were quite good. Like I emailed them and they emailed me back within like a week and stuff.
Is PALS just for hospitals, or is it? Can you the complaints board for your GP, is that completely different?
I don't know, Louise. What does it say in the leaflets?
I was asked this question today.
Is this for PALS? What was that? Sorry, I was trying to block somebody off of our group chat.
If you're in hospital and you have a complaint, then PALS would be your first port of call, wouldn't it?
PALS is if you visit.
If you was in a doctor's, in like your GPs, who would you go to then? Would it be PALS again?
PALS isn't. PALS is specifically for hospital. It's not for GP practice. For the GP practice, obviously, you would have to speak with GP practice, and then
okay.
As to the complaint further on from there, I wouldn't know because I've never actually made a complaint via the GP.
You'd go to the practice manager, I'd have thought.
Yeah.
But other than that, I don't know, because I mean, I took to Twitter when I was in last week, complaining and a certain person we all know had sent me WhatsApp pictures of all the directors in the hospital that I was in, and was like, "Go tag them all," and I found like half of them on Twitter, and I tagged them, and then the next thing I know, an associate director of nursing was coming down to see me about my tweets.
It's a powerful tool, the internet, in the right hands.
It is.
I wasn't being I'd like to think I wasn't being an entire jerk, because I do get better care, person-centered care for colorectal stuff anyway at the Friary. They are a much smaller hospital, which helps. But I don't know if this is happening elsewhere, but I know it's happening. It's like affecting the hospitals Graham goes to. All my local hospitals are getting wards closed down, and they're getting moved to other hospitals, and then they're not having enough staff, they're not being funded well enough, this, that and the other. Like Jess Sandyford, she works at one of the hospitals in Darlington. Loads of their wards are closing, and they're all just getting shipped to Middlesbrough, and Middlesbrough got no chance to keep up with the demand and stuff. So, and the next ones you can get sent to for colorectal is like the RVI in the Freemans, and then the LGI in Leeds. Like, so, but there's not enough staff, there's not enough benefits for staff to stay in places, and it's all underfunded massively, and sometimes that's why you're not getting correct care. Sometimes it's down to miscommunication, and then other times you just get the unprofessional twats like I did, and it's sad, really. But you've got to be, I believe when you're complaining about stuff, you should find something positive, because there's always something positive, whether like one of the medical staff has been fantastic. Like when I was in A&E, there was the nurse practitioner and there was a general nurse, and both of them were amazing.
Mm-hmm.
The junior doctor and one of the male nurses, not so much, But you've got to find your positive as well. You've got to learn to pick your battles. It's a positive
negative sandwich, isn't it?
It is.
Yeah. You have to add a little bit on. If you're going to slag someone off, you have to make it a little bit nicer at the end or at the start in order to make it easier to digest.
Yeah. Because with me, in my personal life, if I say something horrible or judgmental, I have to try, for my own sake, I try and think or say 3 nice things about that person, because that requires more effort than thinking about something negative.
Yeah.
And I'm trying to offset my karma. Karma's going to get me one day. So
can
I
just say goodnight? Can I just say goodnight to Rachel? And I totally forgot to thank her for last week and helping me through it, because it's been a struggle. So massive thanks, Rach, and good night. God bless. I'll speak to you tomorrow. Okay, that's it. I'm going. Bye.
Steve, Elaine emailed and she said, say to Steve that any fitness instructors who are decent would say anyone signed off work should be able to go to the gym if they can manage it, because it helps for your mental health. So a decent fitness instructor would always encourage you if you can manage it. But she can understand the guilty feelings.
Yeah, the guilty feeling, and I think half of it is it could be me overthinking things. What if you're seen at the gym? What if they're gonna? Because I'm picturing it all in my head. They're gonna say, "Oh, he's good enough to go to the gym, then he should be at work." Because obviously, you hear about someone in the gym. My initial feeling is, "Oh, they're in there pumping weights," whereas they might just be walking on a treadmill, with a little incline. So it's half of it might be myself and the way that I'm thinking at the moment, overthinking stuff.
Mm-hmm.
So worst case scenario is someone sees me at the gym. So what? I suppose. I've got a doctor's note that signs me off till X amount of days. So
that's right. Those don't know
what I do, I suppose. So I suppose I should say sod it and just do exactly what I got to do to get myself right.
Mm-hmm.
If it's going to make your mental health better, then when you get to work, you're not just going to go, oh shit, and everything overwhelm you.
Yeah.
You've got to be right, both mentally and physically, to go back to work, to do your job properly, keep your colleagues safe, whatever, depending on your job.
Will you go back on a first return, Steve?
They'll do. They are pretty good. They'll do like a phased return, probably 4 hours for a week, and then increasing.
So that's good to know. They're helpful.
No, they are really good like that. I mean, obviously, my last sort of period of absence like this was 3 years ago. So, in them 3 years, I've accrued quite a bit of sick. 16 weeks is my actual time that I've got off.
Mm-hmm.
That's on full pay, and then it goes to half pay. So fingers crossed that should be enough.
Can I just say quick apologies on the lot for the group chat and my comment with regards to John Tamarack, but word of advice, if you are still watching, please stop posting those comments up on the group chat. It's for people asking for help, not to be disgusting. So thank you.
Oh dear.
Yeah, get a grip, man.
Yeah,
So-
pretty much.
You can.
I don't have the group chat, you see, because I'm working off a Samsung phone. Just saying, there are other phones out there, yeah. Just to let you know, I'm working off a Samsung phone, and I haven't got this the beauty of being able to punch away and speak to people in other chats.
I only do mine off my phone now, Steve.
If you see me talking to my, it looks like I'm having a conversation. It's actually I'm talking to me. You know what I mean? And the voices, they know what they're on about.
The voices are whispering.
Oh no, they never whisper. They're very loud.
So other than PALS and social media, what other ways have you complained? So with Jacob, a few people might be aware of how awful his birth was. Again, that's on my blog. I still struggle with thinking about that. I made a formal complaint to one of the obstetric consultants that I know that actually brought Lyrebeth into the world. And he was like, "Are you wanting to make a proper complaint?" And I was like, yes, I do. So I met up with the head of the maternity, and we went through my notes and everything, and they went to give feedback, because let's face it, if you don't complain about stuff, people aren't going to be able to improve. You can't improve on stuff you don't know about.
That's
Absolutely.
true.
It's like you can't learn from your mistakes unless you make them.
You can also
register. Oh, no, go on.
No, in the hospitals, as well as the PALS leaflets, they also have the ones with regards to making a complaint. And some of those will have a chief executive with regards to complaints department within the hospital to deal with your inquiries. But each complaint has to be registered no more than 12 months after the fact. So you've got a year to make the complaint. If you're worried about if you're making a complaint, is it going to show on your medical notes? No, it's not. They are not actually allowed to put that on your medical notes, because that's not allowed to impact your level of care that you receive.
It's also data protection.
Yes. They are not allowed to inform you with regards to any disciplinary action that has been taken, unless it is with regards to medical or clinical negligence. So anybody that has been fired, disciplined, or been sent on another training course due to attitude or behaviour, or, like Steffi says, lack of person-based care, then they don't have to inform you of the outcome of that, as long as they feel that they have dealt with your complaint.
So if anyone doesn't know what person-centred care means, it's a term that's bandied about a lot within care settings. So I had it when I was an autistic support worker. I had it when I did Alzheimer's and dementia, and I do it in independent extra care support. And person-centred care means putting the person first. We're all individuals. We all pain affects us differently. Our diseases, even though they're very generalised, affect us differently. Steve and I both had colitis. Both affect us very, very differently. And you've got to listen to that person and talk to that person how they'd want to be talked to. So that means, like, I used to have a lad that I looked after who was basically he was just a pop model of my little brother. He mumbled, he dragged his feet, he played video games all the time, listened to rock and everything. So I used to dress. I was quite lucky that I dressed very similar to him anyway, but I would talk to him how he would talk to me. That's also very person-centred. So with Graham, person-centred would have been someone taking ownership of him needing to be either urology or renal. Person-centred for him would have been someone to turn around and go, right, we know that you need this level of care. You can do this amount of things for yourself.
Mm-hmm.
We will help you and assist you to do this, because that is person-centred care. And yes, it is hard to do when you are busy, but there's no excuse for it not to be done at some point. So that's what person-centred care is. And every healthcare professional in the country is supposed to be trained in person-centred care. It is like in your induction. So every healthcare professional should know about it and should be working in a person-centered way.
Just to switch to the other foot though as well, do you not think that maybe with regards to how short-staffed hospitals are now and how many lack of, I think they have one head nurse that manages something like 16 beds, I think it is, or on a ward, and then anybody else that below that is a delegate or a HCA. Do you think part of the reason why some of the people aren't getting the personal based care is because of the lack of staff being able to deal with that?
That's what I've been told in my recent complaint, but it's I just feel it's an easy excuse out.
No, it's an easy excuse out, but I just thought I'd throw that one out there and ask that one just out of...
It is, but it doesn't stop you being professional.
No, it doesn't.
It doesn't just stop. When I was on the surgical ward, which was the third place they dumped me. I said put me. The nurse that was doing nights had 6 people for the 12-hour shift that she was looking after, and there was like, I don't know. And I was what's classed as a red bed, which they don't put people in the red bed unless it's an emergency. Obviously, I was overflow, and they were trying to get me off the assessment unit. And she, even though there was one guy kept on pressing his buzzer for over an hour for pain relief, and she'd said to him she was working her way to him, like she literally had, a round of people she had to do. She was absolutely amazing. Like, I'd asked if I could have a sandwich or some toast, and she was like, it might be a bit over an hour, but I can get to you. And I was like, that's fine. I'm not dying. I'm not bleeding on the floor. You've acknowledged my request. And I was just about to go to sleep, and she brought me a sandwich, But she still came to me, and just because you're short-staffed doesn't mean you can be unprofessional,
No, the one thing that
I asked for toast.
I asked for toast, I asked for sandwiches, because that's all I was allowed to eat.
Sorry, I'm being pedantic. But surely personal-based care is something that is taught and learned. The same as bedside manner. Now, some healthcare professionals are fantastic at both, and that's down to their personal, that's just down to the way they are. Surely that's got a little bit of, what's the word I'm after? That's got to play a part. The actual person themselves and whether they're good at that part of things. You could be fantastic at your job, but if your bedside manner isn't brilliant,
the empathy,
yeah, it kind of like you remember that, don't you? You remember the nurse that was kind to you, that spoke to you gently, and you took everything on board. The one that was a bit sharper and harsher, he or she may have been saying exactly the same things, just in a different manner. And you're in quite a vulnerable state when you're in hospital anyway.
I had issues in 2012. I transferred my care from Medway Trust to London Trusts, and in the course of being transferred, I'd had an MRI and they hadn't given me my results. And due to the nature of my Crohn's, I developed abdominal abscesses that were coming up from the old surgery lines, and they'd come up through my abdomen. And I went to Pembury Hospital because I was in agony, and I had to go down to theatre to have the abscess removed and scraped down, and obviously I had to have it scraped out, obviously down to wound bed. And one of the registrars that come in to see me before they took me down to theatre was the same registrar that told me I was no longer fat and had hips about 8 months after having Maisie. She was the registrar that did my surgery, the life-saving surgery, when I was at Medway. And I didn't like her. I didn't think it was overly professional for her to turn around and say that to me when I had an open wound and I wasn't keeping weight on. And I'd lost. She said it was amazing to see that I was no longer fat and actually had hips.
That's awful.
Oh my God.
That's really terrible. The thing is, you're going to remember stuff like that, aren't you?
And I put in a PALS complaint at the time, and I said that, I'm putting in a complaint and I don't want her on my case anymore because I thought that was incredibly unprofessional. And talking to a patient that's on TPN, has an ileostomy, is dealing with an open wound, and has been through a pretty traumatic experience, to then have your weight picked at by the registrar that originally did your surgery, knowing the case that I'd just given birth 3 days prior to having that surgery, she should not have said that. So anyway, I've gone into Pembury. I was in there for 2 weeks, and I was in for 3 days prior, because there was MRIs, CT scans, and everything else to locate the abscess, make sure it wasn't another fissure and everything else. Who walked in with my consultant, and I was like, you have got to be having a laugh with me. So yet again, when she left the room, I spoke to my consultant and I said, I don't want her anywhere near me. I said, I've had run-ins with her before. I've made a complaint against her before. I said, and obviously wherever that complaint got to, said in the last 2 years, I said, she's changed trusts. I said, and I don't want her in here. I said, because if she makes a comment about my weight, or a comment about the fact that my resection's gone well, or a comment about the fact that the abscess could possibly be my fault, I said, I don't think you'll appreciate what I'll turn around and say to her.
I remember being 14, being in the LGI in Leeds, after being transferred from my local hospital, because I needed specialist care, having what actually ended up being a bloody migraine, the first migraine I'd ever had. I was on very high doses of steroids, very high doses of lots of other stuff, and screaming, I couldn't see, I freaked my mum out, she thought I was dying, I had to have a CT scan of my brain, and obviously it ended up being a migraine because my body just couldn't deal with the steroids. Then one of the nurses the next morning turned around to another nurse whilst checking my observations, thinking I was asleep, and said she thought she was dying last night. How pathetic is that? She just had a migraine, and my mum didn't hear it. I was when they left the room. I told what my mum had told her, and because she was in the room with me, and she was mortified. She was like, "She's not coming back in, not at all." Just before I was having my ileostomy surgery, I contemplated drinking all of my morphine and going for a walk. I put myself in hospital the next day. I just went down to A&E and I admitted myself because it wasn't safe for myself and whatever. And one of the junior doctors was like, I can't be asked to deal with you anymore, and walked out and slammed the door. My best friend was sat there. My best friend walked out into the reception area of the ward by the nurse's station. I'd like you to ring security, please. And they were like, why? And he was like, I'd like you to ring security. Just ring security. My dad was on shift on security. So my dad just came up and helped me. I was in bits. I was in absolute bits. They hadn't sent anyone to see me from a mental health team, and I was quite clearly vulnerable and in a bad place. And it was appalling. And I hope that junior doctor never, ever, ever qualifies, because she was disgustingly bad. She was bad to every single patient she saw over the 2 different wards I was in whilst I was in that week.
Wow. I've never... People like that, they don't belong in that profession, do they? It should be a caring and loving profession. And of course they're going to have hard times, but, you know...
I understand there was nothing they could do because they couldn't bring my surgery forward, you know, but they could have just referred me to mental health. That's even if that's
no
all
need
they
for unprofessionalism like that.
Exactly. And that's the thing. We all have problems, and we all do the whole try to leave the problems at the door when we walk in, and it doesn't always work that way. I mean, I've had breakdowns at work where I've cried, but I've done it obviously away from where people should be able to see me. And then you try and book yourself back up, you know, and carry on. Sometimes you can't always do that, but it's not the person in the patient's fault. Unless the patient is being unalterable. There's plenty of patients that are unalterable.
Sorry, just to throw that one out there. So you're in hospital, you've had a bad experience, you feel that you've received lack of care, or that you're not being listened to, or various numerous options. So you can get family members to make the complaint to PALS for you. PALS can come and see you up in the ward if you are an inpatient. However, how many of you actually want to call PALS to come up and see you on the ward and sit down next to your bed and take a complaint if the person that you're complaining about is standing at the bottom of the other bed?
No, you wouldn't be happy about it, would you?
No.
No. Obviously, PALS advise that they cannot provide advocacy, diagnosis or medical advice. However, we can raise your concerns and questions with people who provide those services. I've had another email from Elaine, but she said with regards to complaining to the GP, you typically write to the practice manager, and she wrote them a letter because they were only going off of the computer screen for her blood test results, and she was on azathioprine at the time. And 3 weeks, the GP had never even seen her, and she nearly ended up readmitted back into hospital because her bloods were toxic. And that was based on a GP saying that she didn't need to have her weekly blood tests and changed the frequency.
I have a question. Sorry, Graham, carry on.
My current complaint of this last admission just a few weeks ago, I went through the matron of the department. There was 2 or 3 different issues, but the main one was the stoma care on the ward. I always like to have a set routine where the bags changed every day. And they said they were going to change it before surgery, but we didn't have time. I appreciated that. And they said, tell you what, take the bag down to surgery with you. And if there's any issues, they'll do it down there. And they knew all about that. So I was quite happy with that. No problems at all. So got back onto the wards in about lunchtime. And by mid-afternoon, I was starting to feel myself again. I reminded them that it needed changing. And they said, oh, it doesn't need doing now. I says, no, just when you get 5 minutes, not a problem. So a couple of hours later, I reminded them again. This was about 7 o'clock. And they says, oh, we'll get to you, not a problem. So 8:30, I asked again. I says, the bag's starting to lift. All right, we'll come and change it in 2 minutes. Next thing, one of the student nurses came. And she said, oh, I've been told to come and empty your bag. I says, no, it doesn't need emptying, it needs changing. Ah, right. I'll go and tell the nurse. So off she goes. And one of the other nurses came back and said, we'll mention it to the handover, the night staff, those will do it. I says, all right, but it does need doing. So 10 o'clock, it was getting worse and it was starting to leak. So I mentioned it again. We're a bit busy at the minute. Well, I'll get back to you as soon as I can. So I left it another 2 hours. This was midnight. And the nurse came back and she said, oh, we're really busy at the minute. I don't have time. I'll just tape over it. So she went away and brought this tape back. And she was putting the tape on. She says, it's no good changing it now anyway because the lights are off. If we put the lights on, it'll wake up the other patients. And that didn't go too damn well with me.
But you have your own light, don't you, on a bed?
Exactly.
That they have to put on if you need a cannula changing.
I think, regardless of whether they're a stoma nurse or not, I think that the nurses should be changed to change a stoma bag.
Exactly.
I
left it another 2 hours, 2 o'clock in the morning, press the button again. We don't have time, we're really busy at the minute. If I get time, I'll come back and do it. But I told them, I says, it's leaking. She says, but you've got tape on it, it'll be all right. I says, but that's not the point, it's the skin underneath. That's worrying us. Oh, it'll be fine. So I left it at that until 5 o'clock in the morning. Oh, we're just about to wake the patients up, leave it to the day staff. So as soon as the day staff came on at 8 o'clock in the morning, and they were bringing round the medicines, first thing I say is I need the bag changed and it's leaking badly. And she says, we've been told this at the handover, we know all about it, we'll come and do it when we get 5 minutes. And then I literally snapped. I said, look, I've been waiting since mid-afternoon yesterday. That's 3 different shifts I've been through. I said, it's itchy and I'm sore. And it should have been changed last night. And the nurse just looked at us and walked away. And 5 minutes later, she came back. She said, oh, I feel guilty for not changing it last night. But she says, I'll stand by what I said or what my staff said last night. You know, we're very busy, short-staffed.
Yeah, but that doesn't matter. I'm not being funny, but all nurses, all HCAs and nurses, regardless of whether they're stoma trained or not, need to know how to change a stoma bag.
I says, it wasn't, the issue was that it was the skin. that could have been damaged really badly.
Mhm.
The fact that they taped over it when it would have been just as quick to change it.
The thing is regardless of whether you're able-bodied, non-able-bodied, or just don't want to do it, when you're in hospital and you've had surgery and you've been drugged up, you can't change a pouch properly. It takes you a couple of days to get to grips with everything because it all takes a longer time to change. It all takes a longer time to clean. And leaks when you've had surgery, or if you've had a bag on for an extended period of time above your usual, is possibly going to cause a leak. I mean, when I had my stoma formed in 2016, I had issues with the HCA. My bag had leaked overnight. They had the flat ones on me, and I'm not flat, I'm convex. You stick a flat bag on me, I'll leak within an hour. So my bag's leaked and I'm going to the HCA, can you help me? Because it was everywhere. When you have surgery, your stoma output is like water. It flushes out, it comes out, you have to empty the bag and everything else, and it leaks. There was no polite way of putting this. There was output everywhere. There was a trial from my bed across, out the wall and down to the toilets where my bag was leaking, where my stoma was flushing that bad. HCA would not clean up, she would not change my bed, and she would not help me change my bag. So do you know what I did? Instead of cleaning it up, I left it and I got matron on morning rounds. That didn't go down too well.
See, the only time I've ever been left like that was when I had a bowel catheter in after my first surgery. That was my mum and my sister stopped their day of shopping to come and clean me up because the nurses wouldn't do it for the third time. And I was like, I'm laid here. I just have to shift. I was like, it is not my fault. I'm not doing it on purpose. And I was left in the shower for over an hour, just left there in a chair crying. And I couldn't even stand up at that point. So, but you know, I didn't complain about them. There's a lot of the time when you just think it's just not even worth it, you know, but you should at least say to someone on the ward, because that...
I've been lucky in that respect. What I did have a question was, completely off subject, it's for Steffi. So ulcerative colitis, my large bowel is gone. Now the remaining colitis was in my rectal stump. That's gone. Do I not have ulcerative colitis anymore?
You don't have the capacity for active disease, but ulcerative colitis doesn't just affect your bowels, it affects your joints, it affects
obviously it's an inflammatory disease.
This is something Shelley and I've stood by for a long time. You don't have the capacity for active disease, but you still have IBD because it's genetic. You know, it's in your genes. It's not just your bowel, but you just don't have the capacity for active disease. I still say that my medical professionals and doctors still say that I have colitis, even though I have no capacity.
Well, this is it, you see, because I'm on methotrexate for my arthritis, which is also, you know, an inflammatory disease, an immune disease. They're waiting until my wound stops, fluid stops coming out of it, until I can start up my Humira again. But I'm wondering now, since my colitis is gone as such, will my arthritis calm down?
No.
Is there any?
Sorry.
No,
it won't. Okay. Sorry.
Even though the colitis has gone, Steve, you still have the autoimmune. It's still in your blood. It will still affect everything else.
Originally, it was diagnosed as AS, and now it's RS. No, RA, rheumatoid arthritis instead of ankylosing. Originally, they did diagnose it as ankylosing spondylitis, but it was only ever my hip and the base of my back. That it was sacroiliitis of the hip with the sacrum and the ilium join. That's where all my pain was. All my other pains really are just age related. You know, like my knees. I've got arthritis in sort of that ball there of my hand, but that's pretty much it. That and my hip. Now my hip, when it flares, it's the worst pain imaginable. You can't walk. You can't sleep. You can't sit down. It's just horrific. Fingers crossed, you know, it's been under control since I've been using them 2 drugs, which never worked for my colitis at all.
Stephen calls my hip my granny hip, because if I'm laid on it, it then feels like it's going to dislocate, or it's always my left hand hip that drops out. It doesn't actually drop out, but the muscles relax with my hypermobility, because that's what they do. They relax, and then your joint isn't supported properly anymore. But yeah, Stephen calls it my granny hip. He said he's married a granny now because I have really bad hips and knees. Do you have a grandpa hip?
Well, you know what? It's been fantastic, and I'm counting my chickens and praying that it continues, because I wouldn't wish that pain on anyone. It was way more painful than anything bowel related that I've suffered. You know, if I'm just so glad that they never both flared at the same time. So that would have been horrific. I'd have been needing the toilet and wouldn't have been able to get there. You know what I mean? And
I had to have a full bladder for my CT scan, and I sit down to empty my bag. So I refused to sit down in case I emptied my bladder by accident. So I was stood there, and the toilets were so low off the ground, and I'm not exactly short. And I had my knees and my hips were in agony, and I was there going, "Oh my God, I'm stuck." I had to
you're like
move myself back
in a
up.
squatty mode.
Oh no, I don't know what position I had to do. No, I was stood facing the toilet, which is like, but I knew if I'd bent down, I wouldn't have been able to get, like, if I'd knelt down, my knees wouldn't have taken that, and I wouldn't have been able to get back up. And I'm not going to be the person that rings when they're in the toilet because I'm not doing it. But no, it's so anyone that, like Natalie, she suffers quite badly when her joints are bad and emptying a bag. It's not a fun thing to deal with.
When I used to have a spasm, and which would flick you straight up, and then if you're in the middle of like emptying your bag, then you gotta have a look around the bathroom. Where did that go? it's you know, the pain is real.
Well, on the note of Crohn's and colitis, it's Crohn's and Colitis Awareness Week from the 1st until the 7th of December.
Yeah,
guess what we're covering next week.
And I'm not here because I'm at work.
Ow, bug. Didn't say that. Okay.
It's after 9 o'clock. It's all right.
It's all right. So yeah, next week, obviously with it being Crohn's and Colitis Week, we will be talking about IBD related things. So anything from Steve's joint pain to just us being rather crass about toilet humour. So that's what we will be covering.
There's no we about that. There's just Louise being crass about toilet humour.
Genuinely talking shit. In other words.
I love it. So yeah, that's what we are covering next week. So we will be back at 8 o'clock.
Thanks for coming on, Graham.
That's all right. Can I just say one thing?
Sure.
No.
I'm a celebrity. Get me out of here.
I thought you wanted to go. I thought you was twitching. I can smell dinner cooking as well. I'm so hungry.
Big shout out to Rachel and Natalie.
Yes.
Yeah.
Hopefully see you back soon.
Yeah. Hopefully Natalie's stomach stops bloating and giving her cramps and pains. Basically, she's having all the pain I was getting last week, except hers isn't necessarily directly under her ribs. But hopefully her family Christmas photos have come out all right, because that is why she's not here tonight. Every year they have a family Christmas photo. So nice to have a tradition. I don't have that pleasure of traditions like that.
My tradition is that I always try and breathe every day. I find it really helpful for my life.
So after the comments about Steve saying that I'm full of shit and other people go, well, that's going to be a shit-filled episode on the group chat, I think it is time to call it a night. So I'd like to say thank you to everybody for watching. We'll be back again next week. Big thanks to Graham. We miss you, I was about to say Steffi. We big love and misses to Nat and Rach, and I hope to see you two next week. And I will see everybody next week.
Thanks, Graham. Thank you, guys.
Bye.
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 Bye.